And next we have Tahra Babiker-Moore, who will present on preoperative serial casting, stretching, and massage therapy. Thank you.
Oh, I got a clicker somewhere here. Hello, everyone. My name's Tara. I'm a hand therapist from Dorset County Hospital in the south of England. Repeatedly, I see how Dupuytrens can profoundly affect people's lives. And regularly, I get asked by patients what they can do to help themselves. So today, I'm really excited to share with you a research proposal. So, a proposal that aims to take the first step towards changing the way we treat people who have Dupuytren's fasciectomy. This research is jointly funded by Bournemouth University and Dorset County Hospital NHS Foundation Trust. So our proposal, a feasibility study investigating whether preoperative serial casting, stretching and massage therapy can improve outcomes of Dupuytren's fasciectomy patients with a PIP joint contracture exceeding 30 degrees. So that's our what, and we'll come back to that in a moment. But what's more important is our why. Our feasibility study is grounded in 4 key strands of preliminary work. So a systematic review, a survey of hand therapists, a review of clinical guidelines and research priorities, and direct input through patient and public involvement. The systematic review focused on the 5 most common elective hand surgeries. It was published in the Sage Journal of Hand Therapy in December 24. Sadly, I haven't got time to elaborate on the details of that study here. They are in the paper for those of you that are interested. But I will say this, the takeaway was clear. There's a huge missed opportunity to improve outcomes by preparing patients and optimizing the hand prior to surgery for any of these conditions. And so, which of these 5 surgeries should we focus our preoperative research on? For this, we went to the experts. We conducted an anonymous survey of UK hand therapists, asking which surgeries would benefit most from preoperative therapy. Again, I can't elaborate on the details here. They're also been published in the Hand Therapy if you're interested. But what I can tell you is that therapists unanimously endorse preoperative therapy across all the procedures, but Dupuytren surgery was highlighted as one of the top priorities. Next was an exploration of clinical guidelines and research priorities via the National Institute of Health and Care Excellence and the James Lind Alliance. Findings here also echoed the need to advance clinical research for Dupuytren's patients. But arguably, more important than any of all this evidence, what do Dupuytren's patients think of the potential of preoperative therapy at improving results of their surgery? So for this, a big thank you goes to Anna and the British Dupuytren Society. Their support has been invaluable in ensuring that our research is both relevant and acceptable to the community it aims to serve. We recognise the importance of patient and public involvement in shaping truly patient-centred research, and we've worked incredibly hard to involve patients with lived experience of Dupuytren's at every stage of our research. We've established a dedicated patient and public involvement steering committee, and as part of that process, a patient survey was distributed via the British Dupuytren Society, asking patients how we could serve them best. So survey results, together with ongoing input from patients and the clinical experts that treat them, have formed the very foundation of our intervention design. We're also in the midst of writing a paper now where you can actually look at the direct input our patient involvement has had on our research. So, patient involvement, the systematic review, therapist survey, and guideline analysis. None of this was just research for research's sake. Our goal is simple: to design an intervention that genuinely improves the lives of people living with Dupuytren's. So that brings us back to our what, our feasibility study. The primary objective here is to assess whether it's feasible to conduct a full-scale RCT, looking specifically at inclusion criteria, acceptability, outcome measures, and required sample size. So we aim to recruit approximately 20 participants, so that will be 10 to each group, the intervention and the control. And the intervention is a structured 4-week preoperative therapy program involving heat, stretching and massage, followed by the application of a serial cast. The cast will be adjusted weekly to allow for gradual elongation of restricted tissue. The final follow-up will take place at 12 weeks post-operatively. As a therapist, I'm committed to delivering outstanding patient-centred care, care that is really grounded in the application of sound evidence. If this feasibility study demonstrates that our preoperative intervention is practical and acceptable to patients, we can then confidently take the next step to conduct a full randomized control trial to formally evaluate clinical effectiveness. And that future trial has enormous potential. It could inform and shape clinical-based guidelines and indeed improve outcomes for Dupuytren's patients. This is the first step at exploring the impact of preoperative therapy on elective hand surgery. And ultimately, this feasibility study isn't just about assessing an intervention, it's about reshaping care pathways, empowering patients, and improving lives. Thank you.
Questions? I'm sure there will be. It's been lively this afternoon. Yes.
I would encourage you to make the same survey a year later. Mandy and Anna made this at the last symposium. They looked for patient satisfaction after 1 year, and they could look over the whole series of doing. And it was interesting that most of the patients were better and better evaluated with radiotherapy than with surgery.
So for outcome measures, we did actually use our steering committee. We went to our patients and our therapists and our surgeons, who are all part of our PPI committee, and we asked them what outcome measures were most important to them. And surprisingly, or at least I felt surprisingly, it was the therapists who went for functional outcome measures, and range of movement was definitely the most important measure for patients.
I've had a good few referrals from people like yourself, where the patients had one hand treated with surgery and then developed Dupuytren's in the other, and they refused to have more surgery because it was painful and the result wasn't good. So that's how I get patients from people like yourself. They didn't want to go through it all again. Surgery.
Yeah.
Radiotherapy is much preferred.
Okay, thank you.
Well, especially if you want to do the best for your patients.
No, absolutely.
The truth. Because surgeons often don't tell patients that radiation treatment exists. They don't tell them. Surgeons like to operate.
So as a therapist, I genuinely in the UK don't see patients, Dupuytren's patients preoperatively or as part of a conservative management plan.
Patients that come to you post-operatively have surgery on one hand and then get disease in the other.
So I would treat them as part of their post-operative care as a therapist in the hand that they've had surgery on, but then I probably wouldn't see them again if they're not having surgery on their second hand.
They often ask you for advice. What would you do? And then you have to be brave and say, well, try radiotherapy.
Okay.
Question here.
In terms of the economic impact of this, so is preoperative Dupuytren therapy a covered expense? I'm not sure.
At the moment, we're looking at treatments at the NHS. So the original systematic review looked at preoperative therapy for any hand surgery, and there's very little out there. There's a couple of American studies looking at opioid use, so an information intervention preoperatively to decrease opioid use postoperatively, which has worked very well. But there's very little else on preoperative interventions for the hand. But what there is a lot more on the hips and knee, and now that is part of our sort of normal NHS care pathways for hip and knee surgeries.
Does the NHS pay for preoperative splinting for Dupuytren currently?
It would, the idea is if the evidence is there, it becomes part of our, yes, it becomes part of those new guidelines which would feed into the NHS pathways, yes.
Thank you.
Anything else?
Anyone? Thank you very much.
Thank you.